How do we reboot the entire system with an operating system, if you will? How would we do that?
Yeah.
And I think doing it inside out, meaning going to every enterprise, like every health system, every provider, every clinic, every home health provider, every other lab, a health payer and a plan and a provider spot, this or that. There's like hundreds of thousands of these entities out there. And at a minimum, every one of them is 10 years behind where the tech is today, generously. Some are probably 30 years behind. So everyone's trying to do the right thing with incredibly bad technology and incredibly bad processes that are really the main culprit, as opposed to bad intentions, bad actors, and all this other stuff that just gets talked about as the easy stuff. If you look at the healthcare payer stocks, everyone's down 30 to 40% over the last 2 years. And why is that? Because no one is able to adequately predict medical costs. Have the payers expose all of their transactional logic as APIs, which they already do, because guess what? All of the call centers and mobile apps and portals all have to need that anyway. So that work is already done. So let's reuse it for the purposes of transaction settlement. So then you need an entity in the middle that can look at both sides without disclosing anything proprietary to either side, essentially mediate that. So it's the beauty of this is in the simplicity of it. Someone was saying for the 200 years of tech evolution in our world, simple is always one. And guess what? The one thing that healthcare is not is simple. So it's like bringing simplicity back to healthcare.